Did you know only 6% of people are getting enough fiber? That's why Quaker created Fiber February, a month-long movement to show your gut a little more love. It's like dry January, only easier and more delicious. Quaker has over 100 delicious options that are a good source of fiber. So go buy Quaker Oats today and join the Fiber February movement for a healthy gut.
Hey everyone, Chris here from MedPrep2Go, and I wanted to ask you to please follow us on social. There may be links in the show notes, or you can find us at MedPrep2Go on Facebook, Instagram, LinkedIn, and now YouTube. We'd greatly appreciate it as we try to spread the word about MedPrep2Go and keep medical education accessible and affordable. Welcome to the Dr. Raj Podcast. Today's episode features Everyday Rheum, a guest series hosted by Dr. Michelle Koolaee. She is a board-certified rheumatologist with a direct care practice in Pasadena, California. She trained at the University of Pennsylvania and serves as faculty and educator at Huntington Hospital, an affiliate of Cedars-Sinai. Inspired by the conversations she has with her clients every day, this series brings practical insights in rheumatology to patients and the medical community alike. And now, here's today's episode.
Hi, and welcome to Everyday Rheum. This is a guest series on the Dr. Raj podcast, and this podcast is inspired by the real conversations I have with patients every day. Our goal is to bring you knowledge, support, and encouragement to help you manage your rheumatology needs with confidence. So today's guest is an amazing and resilient individual, Vanessa. She is young and was diagnosed with lupus just this past summer while she was in the hospital. Before we dive into those first few weeks of her diagnosis, I want to share why I asked her to join us here today. Now, the early stages of chronic rheumatic illness, they can be overwhelming for anyone, any age, but it's especially challenging when that diagnosis comes during a hospitalization. And Vanessa, I truly admire the grace and strength with which you have been navigating your health journey. And I want to share that with the listeners here today, because I really believe that your story will help uplift and encourage others who are maybe going through the same thing, and so that they also feel like they're not alone. So Vanessa, thank you so much for being here today.
Of course, I'm so glad to be here.
Great. Now, before we dive into your health journey, tell us a little bit about yourself.
I'm 23 years old. I'm currently a student. I'm in my last semester actually, so I'm excited to graduate soon. I'm completing my undergrad in early childhood studies. So I hope to work with children in some capacity, maybe like as an educator or counselor. But yeah, that's kind of what I'm doing right now.
No, that's great. And you have a very friendly demeanor, so I think you'd be really good with kids. And so let's go back to where the journey started, like over the summer. Now, for listeners, Vanessa was admitted to the hospital over the summer, and there's a lot going on at that time, wasn't there?
Yeah.
And she was significantly anemic. Your hemoglobin was like 5, which for people that are non-medical, like that's very low. You had a lot of chest pain. We ended up discovering that you had a pulmonary embolism, which is a blood clot in the lungs, as well as arthritic symptoms. You were on high-dose steroids. You've received rituximab, which is a immune suppressant treatment to really help manage all the inflammation that was going on. And then as well as being on Eliquis, which was a blood thinner. And so take us back to when you were first diagnosed and what was going on for you at that time, and how did it feel to be in the hospital and learn that you had lupus?
I had been experiencing, I feel like, symptoms of like arthritis or whatever for a long time. Mm-hmm. But during that point in time, it had gotten like really bad, where it was like really hard to move, really hard to like do just like simple everyday tasks. So doing work and school got really difficult. And so, yeah, that's why. And then like also like the chest pains and like trouble breathing. Mm-hmm. I had gone into the ER because like it kind of came to a point where I was just like, I don't know what to do anymore. Mm-hmm. And that's when I got admitted, and it was scary for sure, because it was kind of like they brought on early on that, like, it's a possibility that it might be lupus, but we're still not completely sure. So it was a lot of like, oh, it might be, but also there's a chance it's not, kind of thing, what was going on in my head. So I was like, I think I was in that mindset of like, maybe it's not, maybe like, it'll just be like a one and done like treatment thing and like I'll be good to go. But like eventually it was like, yep, it's lupus. Like they were very supportive. They were very like, we're going to do everything we can to help you, to like, get you everything you need so you feel better. So yeah, that's what that was kind of like. I feel like once I was in the hospital, the like medications I was receiving, I was slowly starting to feel like a lot better than like what I had been feeling for like the past like 3 years, even like I had been experiencing symptoms. So even though it was like scary, I felt like there was like I was finally getting what I needed to feel normal again, I guess, or to like my old self when I wasn't experiencing like all the pain.
And so when you were having joint pain symptoms for some time before the hospitalization, was there some part of you that thought that you might have some type of autoimmune condition?
For sure, yeah. I mean, going through that, I feel like I was always like looking up like, oh, like I have like joint pains at this age, like what could it be? And it was always like, what always came up was like rheumatoid arthritis, autoimmune disease. And I was just like, okay, like what do I do? I'd go to doctors and they'd be like, I would get blood tests and they didn't see like anything like too abnormal, but I'm not too sure like what that was. But they were just like, what you have to do is you would have to go to a specialist and see. And I don't know, in my mind, I don't know if it was like a part of me that didn't want to like be like diagnosed with something too severe that like I kind of just like, oh, I don't have time for it. I have like all this other stuff going on. Like I'll deal with it later kind of thing.
Yeah.
But yeah, I like for the longest time, I'm like, there's something that's wrong for sure. Yeah. It's just like a hard thing to like, approach, I guess.
It is. I think it's hard on many levels because I think that like even before we talk about the hospitalization, it's like having chronic persistent symptoms and kind of knowing, okay, so you kind of knew something was probably autoimmune, but it's the feeling of denial perhaps, or just, and I think it's good to talk about that because it's not uncommon. Whether someone's younger or older, I think there's feelings, and you can echo what some of the feelings you felt, but people that I speak to, it can feel very overwhelming and like there's a lot of moving parts. And is it medication, what medication, and so I think there becomes this way of being where you're kind of like accommodating to your symptoms and what do you feel about that? Is that something that did you feel that is that am I accurate in making those statements for you as you were navigating through your symptoms initially?
When you say like accommodating, like adjusting what I would
yeah
do,
like because
like,
you were having joint pains and you were having like it, but you were kind of maybe, and again, things that I hear other people like they are maybe less active and they're like not moving as much so that they don't have pain, and so you're like yeah
I mean, I feel like I was isolating a lot, like I was like at home a lot and just like not doing things that like it was hard to like I'd be asked like go out with friends or like try and visit my family and stuff like that, and it was more so just like it's easier to just stay home, not do anything. And I dealt with it in a way where I was just like I'll just do nothing or kind of thing, like and then like maybe hopefully I'll get better and then I can go back to doing everything. And then like I would get like a little bit better at times to be able to just get by each day kind of thing with school and work. And that's kind of what, like I would prioritize that over like my mental health kind of thing. And for sure I was living to just go based off what I was capable of doing at the time because I didn't have any kind of treatment or medications.
Yeah. And help. Oh, sorry to interrupt. Yeah, I was going to say too, for just for listeners that it, I always tell patients like you don't have to suffer. That biggest points of advice is number one, knowing your body and knowing your symptoms. And it is not normal to have like persistent joint pain, stiffness, swelling, and that it is really important to seek care early, because and for various reasons that we discussed, like it's not always, there's a lot of feelings that might go into that, but I think that it is really important getting care early to know what is your diagnosis, that there's a lot of these conditions are very treatable, as we'll talk about your journey, but so going back to the hospitalization now, and thank you for sharing all of that. I think that really echoes what a lot of people experience in their journey, and especially people that I take care of that are younger, but like older too. I think that it is, humans are different in the way that they kind of address health. And so, but going back to the hospitalization, you were admitted. We were doing all this testing, newly diagnosed. So some of the feelings, then you mentioned like you felt scared. But you felt supported because it was definitely a lot of people that were working to help you. And so what other feelings, like, again, you were in the hospital for some time. What other feelings do you remember thinking?
I feel like I remember feeling like frustration, I guess, kind of thing, where it's just like I feel like being when I was younger, it was always just like just work hard, and you'll do the right thing, be a good person, and things will turn out well for you, kind of thing. So it's just like frustration of like I've always like worked so hard to like be the best that I can be, and then like all of a sudden like this is like happening to me, where like just daily tasks feel like very draining, kind of thing. So like being there and then like knowing that like, okay, now you have this thing that you're gonna have to deal with like the rest of your life, kind of thing. And then also just I didn't fully know what comes with it either. I just knew that I could have some complications, and it was just kind of like just like on top of everything that I had just been going through. It's just like feeling a little bit defeated at a point, I would say.
And was that in the hospitalization that you were going through all of this, or was it prior?
Prior, definitely. And then like being in the hospital just like for a little bit, like, and then like hearing what I have, I feel like, but then knowing that finally knowing what I have, kind of thing, and knowing that there was something that I can do to treat it, like kind of like it helped me be like, okay, like it was a little bit relieving as well, I would say.
I think, yeah, I was going to ask you, there must have been a sense of relief because you were having symptoms for quite a while, and then now it's like you have a diagnosis. I think that can be very powerful in and of itself, even though like nobody wants a new diagnosis, but it is like, and now we know, okay, we have a diagnosis, we can move forward with treatment. And so I like that you use the word relief, because I think that makes sense given what you had experienced even before being hospitalized.
Yeah.
And I do think a lot for listeners too that are in the same path. I think there can be a grief. It is grief on many levels, kind of navigating through any chronic condition. And as I'll be asking and learning what you're coping, how did you cope, but also just kind of acknowledging that this is grief going through and having a chronic condition, but that by changing the lens that one wears, and the way that you review things, one can actually be like very happy and fulfilled but we'll get to that. So, but I wanted to kind of validate what you mentioned. So, like just on the last question about the hospitalization, is that like what stands out to you most about how you coped, and like what helped you get through that acute phase?
For me, I think it was just like, honestly, after the hospital, I felt so much better than I had felt previously.
Mhm.
So I think that I was like finally able to like see that there's like, oh my God, there's a possibility that I can kind of like do the things that I used to be able to do.
Mhm.
Because for so long I was living each day just like get through it kind of thing.
Mhm. Mhm.
Whereas like like the day I got out of the hospital, I was
Mhm.
like, I'm gonna do this and that. Like, I had so much energy, and I'm sure that was like from the steroids. But even then, but it was just like just all this like I just like it opened up so many like possibilities for me to like I can reach out to friends that I hadn't been able to see for a while. I could spend time with my family without feeling like this like heaviness in my body. So yeah, just remembering that positive feeling that I hadn't felt in a while. So like even during like the harder times where I am like experiencing a little bit of pain, so I'm just like I can go back to like
Mhm.
that energy that I had before. It just may take a little bit of time and then like a adjustment in what I'm doing.
I love that. I think that it's you like highlighted the before and after, and I think I want to pause and for people that are listening that are afraid of treatment or reluctant for medication or seeking support is that there are treatments for this, and you are an example. Your care is an example of where it was just like this, wow, like I forgot what it's like to feel like what is normal. But and I
Yeah,
see and I hear that a lot, by the way, that like people that have chronic arthritides or chronic symptoms, that they actually forget what it's like to do things like before.
hmm,
And but then also I will say that there's this like newfound gratitude, and I don't know if you felt that too, for like things that you didn't like, you weren't kind of one is not aware of, but that when you lose it or it's different, then when you do have it back, you're like, wow, you're like so much more grateful. Like, what are your thoughts
actually,
about that?
yeah, it's funny that you say that. I have an exact moment that like when you said that reminded me of. I remember I was like, it's so simple. I was just cleaning my apartment and I was just like running up and down the stairs because like I needed to like grab stuff. And then I was just like once I like paused for a second, I was just like, I just like was able to go up and down those stairs, no thought about it. Whereas like there have been days where like it was really hard. Like before I was
Mhm.
diagnosed, like I could barely do things like that. Like
Mhm.
and it's just like sitting like with that gratitude a little bit, like
Mhm.
you said, it makes all the difference for like honestly.
And so now that like the dust has settled, you're on treatment, we're really in like, I'm happy with your care and your treatment. How has your day-to-day life or routine been is how is it different?
um I will say I take care of myself a lot better. Whereas before, it was hard to like make sure I was eating right, to make sure I was exercising. Like that was like kind of like not in the forefront of my mind.
Mhm.
Now, like I want to like make sure I stay in like this like better feeling kind of thing.
Mhm.
So I think routine wise, I'm trying to like eat better or at home at least, or uh, buying groceries instead of like eating like really super processed like fast food kind of thing. It's been hard just because like it's hard like money and like time wise sometimes, but
Mhm.
um, I've been trying to put an effort into that to like adjust, and I feel like I've adjusted pretty well. I fall
Mhm.
off sometimes, but
Mhm.
yeah, I've really started to care about myself more, I feel.
I think that's great. I think that it is like sometimes having a change in health, and it really kind of it allows you to also see what's really important. And there's this phrase, health is wealth, which I love that. It is really just like it's so accurate, and it is like your health is important. One does not have to suffer, and it is about always just prioritizing yourself and your needs and your health. And so I know I love that. So what about, like, are there habits or mindsets or people that helped you get through the tougher days, or to change your mindset, or tell me about that.
I would say that you say people, I would for sure say my parents really were there for me during the whole like dealing with the transition kind of thing. And it's more so just being able to like talk about it like openly with them, just because they were there with me like through the hospital stay, especially my mom. She was like there every day. And so she knew exactly like what happened kind of thing. So being able to talk with her, like she every day, every time I see her, she's, how are you? Like, how's your treatment? Like, are you like, what do you need from me? Like, you know, kind of thing. And it's just easy just to be like, oh, like, even talking on the bad days, you know, I'm feeling really tired today. Like, I'm not like feeling like up for much. So she'll like accommodate that to that. She'll be like, okay, like, no worries. Like, you know, so she's been super supportive. So just having someone there that like, I know, like cares about my health kind of thing makes me want to care just as much too. So.
No, I think that's great. I think support is really important, and I think family is definitely great. I think that friends. I think that also even reaching out to like local patient support groups. Like, is that something that you've explored, like Lupus LA, for example?
It's not something that I've looked into. I feel like I've had a pretty good support of friends around here. I have friends with like who've had their own experiences with other like medical not issues, but like, you know, just things that they've dealt with. So like hearing what they've gone through kind of puts into perspective a little bit. Like, you know, we're all dealing with a little bit of something sometimes. So yeah, and then it makes them more open to like listening to kind of like what I'm dealing with too, like them having that open mind as well. So yeah, but I could totally see how like support groups as well could be a great thing to like talk with someone who understands for sure.
Yeah, and I think like I've always I see you as someone that you wear the lens of acceptance, and you go down that path, and you're very grounded in that, and I think you're wise beyond your years, because I think that it is like some people, it's to get to that stage of just kind of peace and acceptance of this is what I need to do to be my healthiest. I'm acknowledging that's not easy for some people, and many people, that it is and so I think it's good, and I love just you're sharing your mindset and how you've navigated through this, because I think that it helps others. There's some people, for example, and maybe you could talk about this, that I see that are so afraid of just the idea of medication, that it actually, I saw someone recently that she was not hospitalized, but her arthritis and her fatigue are really disruptive, but she's so afraid of medication that like really is it's kind of holding her back from kind of really being at her best health. And there's a lot of fear, and there is, again, to a totally different lens than what you're wearing. So what would you say to someone like that, that's like afraid of the medication?
I I feel like because I'm also the type, like, I don't want to take a ton of medication either. Like I would like to be like as natural as possible, but like I feel like the way I think of it is just like my body is not working like it's like it like somebody like how it should be, I guess. And if I could, like, no matter how much I try to like I'm gonna try my best to do to give it what it needs, exercise, like eat healthy, but like sometimes that just doesn't work just because of what I have. So it's just like if just a little bit of medication can just make me feel better and help me be the way I can, like my best self, like where I'm most happy, then like it's worth it. And I feel like having a doctor you trust is really good too. Like I feel like having you and your belief that you want to have as little medication for me as possible too. Like I feel like you've said that in our like appointments before. So like I have this like trust that it's what can help me most. I feel. I don't know if
No, I think that
don't.
really makes sense. No, it's balance. It's balance. It's
Yeah.
kind of, and again, this is where like the lens of acceptance of,
Yeah.
okay, that there's things that happen to one's body and life that are out of one's control, but you can always control how you respond to it and
Yeah.
how you decide to be. And that's a perfect example. So, so what advice would you give, Vanessa, for others that are listening that they find out they just have lupus? What would you want them to know?
I feel like something that I would say is the worst part is not knowing like what's wrong and not having that diagnosis, not knowing what specifically you can do to like make yourself feel better than what you're like going through. And yeah, like there is a way to like to treat it. It takes time, obviously. Like I had a very like positive experience where the medications I was given, they worked right away. Like I felt better like immediately. I understand that's like not the case for everybody, but like it's like once you're diagnosed, you're able to finally figure out like what can I do that will work? What can I, and it may take some time, but it's worth it eventually to get to that spot where you're finally like happy with where your health is.
Yeah, no, I think that's really great. So, and then what about when you think about the future, what gives you hope, Vanessa?
Um, I just feel like there's so much that I can do now. So I'm just like really like now that I'm finally like feeling better, like there's so many possibilities of like all the goals I've always wanted to reach and that just felt like they just weren't going to happen because of how bad I was feeling, that now they're possible again, as like cheesy it may sound, but like I'm just like there's just so much life for me to live that I want to take advantage of.
Okay. Yeah, I love that. I love that mindset. I love that. And I think that's really going to resonate and empower people that are listening. So, Vanessa, thank you so much for being here today, for being so open, sharing your story. I think a lot of the take homes for people that are listening is that if you are having symptoms, again, know your body, pay attention to the signs, the signals. The body's very intelligent. Seek care early. Be surrounded by people that support you, that you trust, and surround yourself with that, and having a healthy mindset really helps in navigating diseases like lupus, and people that are young, people that are old. I think that it is hard navigating through conditions like lupus, especially when it's newly diagnosed. And again, I think that just people knowing you, understanding what you've gone through and how you gracefully navigate through this. And it hasn't been easy for you, but you really have a very bright and optimistic approach, and you have good support. I think that, it is a testament that like people that have lupus and other rheumatic diseases, with the treatments that we have, live healthy, productive, fulfilled lives with immense gratitude for small things, big things, given what they've gone through. So thank you so much for being here. We really appreciate it, and have a great day.
Thank you.
Thank you for listening to another episode of the Dr. Raj podcast. If you enjoy the show, then please make sure to follow us on your favorite podcast app and leave a rating while you're there. This show is for educational and entertainment purposes only and is not intended as medical advice. This has been a production of MedPrep to Go, and you can learn more at medprep2go.com. Hi everyone, Chris here from MedPrep2Go, and our friends at Panacea Financial have a scholarship opportunity for $1,000 for underrepresented residents and fellows. Applications are only open until March 20th, so submit yours today. Apply and learn more at panaceafinancial.com.